Hi, I'm Dr. Tracy Marks, a psychiatrist, and I make mental health education videos. Today I'm answering a viewer question: can a person have unipolar mania? Another way of asking this is, can you only have manic episodes and never really have depression? And if so, is it really bipolar disorder? Bipolar disorder is a disorder where you have reoccurring episodes of depression or mania. Because these mood states are opposite in nature, we say that they have opposite polarity. It's like a magnetic pole that has opposite ends of attraction. At one pole of the mood disorder spectrum, you have depression, which is a low mood state and low energy state, and at the opposite pole is mania, where you have a high mood state and high energy state. For more details on what mania and hypomania look like, watch this video in my bipolar playlist. The traditional thinking is that mood disorders have two categories: unipolar depression and bipolar disorder. With unipolar depression, you have reoccurring episodes of depression only. The depression within bipolar disorder is believed to behave differently from unipolar depression and respond differently to medication. For example, we treat unipolar depression with antidepressants and/or psychotherapy. Specific psychotherapies like cognitive behavior therapy and interpersonal therapy are considered standalone treatments for depression without the need for medication. On the other hand, the primary medications we use for bipolar depression are mood stabilizers first, because many times the antidepressants will make you more unstable by triggering rapid cycling and mixed episodes, where you have a mixture of depression and mania. So what if you only have mania and don't have any depression? Well, unipolar mania is not an official diagnostic condition, but it does happen and it has been studied. It's considered to be a rare situation that someone would never have a depressive episode. What we don't know is if the predominance of mania is a separate condition or if it's just happenstance that you haven't had a depressive episode yet. The way we treat unipolar mania is not much different from bipolar mania, except that you may require less medication than if you had bipolar disorder, because you don't have to address the depressive episodes. Also, some research studying unipolar mania has shown that people with unipolar mania tend to have less comorbidities. Common comorbidities, or illnesses that come along with bipolar disorder, are anxiety disorders, ADHD, and PTSD. So studies show that people with unipolar mania tend to have less of these other illnesses. And this is a good thing because it's much easier to treat mania all by itself than also have to address other problems like attention problems and anxiety. In my own experience, I find treating bipolar depression much harder than treating mania, because with mania, you're in a hyped up state, and although mania with psychosis can be very dangerous, we have lots of medications that are sedating and that can serve the purpose of slowing down mania. These medications can bring you down from the stratosphere, which I also call being on a manic mission, where you get focused on something with tunnel vision and put all your resources toward getting to the finish line. If you've been there, you know what I'm talking about. If you haven't been there, I'm not talking about simply having a purpose and being persistent. I'm talking about losing sight of reality and irrationally pursuing something that's usually driven by a delusional belief. So the analogy is, if you've entered into the stratosphere, I can give you something that takes the wind out of your sails and brings you back down to ground. But it's much harder to pull you out of the deep pit of depression. With bipolar depression, the antidepressants don't do a great job of getting you out of depression. So we end up adding more mood stabilizers to deal with the depressive episodes. It's pretty typical for someone with bipolar disorder to be on at least 2 agents. But with unipolar mania, you don't have the problem of treating depressive episodes, and you don't get mixed episodes. Episodes with a mixture of depression and mania occurring at the same time tend to be harder to treat than having pure mania or pure depression. In my practice, I have a handful of people who have had a predominance of mania or hypomania. And I say predominance because a few of them have had like 1 episode of depression in 10 to 15 years of being in treatment with me. What I have noticed is that they are the ones who do well on one mood stabilizer and tend to have more of an upbeat, high-energy personality when they're not manic. This high-energy personality has been described as a hyperthymic temperament. A hyperthymic temperament would be someone with not only high energy, but also high optimism, who's more talkative and risk-taking, and they usually need less sleep than most people. The normal amount of sleep for an adult is 7 to 9 hours, and people with hyperthymic temperament have trouble sleeping longer than 6 hours. Your temperament is your hardwiring that you're born with, and it lays the groundwork for your personality and the disorders. For example, someone with an anxious temperament tends to be more tense and prone to worry, even if they never develop an anxiety disorder. So the bottom line is, unipolar mania exists, but it's not common, and it may be that you eventually have a depressive episode somewhere down the line. But until you do, if you do, you may do well on a simple medication regimen that addresses only manic symptoms. You'll have to stay vigilant, though, to watch for the emergence of manic symptoms, because you can still have a breakthrough manic episode even on your medication. I talk about recognizing warning signs that your mania is coming in this video, and this video describes in detail what it looks like to have a manic or hypomanic episode. Thanks for watching. See you next time.